Joining me now is that young doctor, Dr. Trupti Gilada, whose emotional appeal has gone viral on the internet. I appreciate you joining us, Dr. Gilada. You virtually broke down while speaking. Uh, is this some anger that has been building up, a sense that hour after hour, as young doctors like you are virtually fatigued, I'm sure, by what's been happening? Tell us what explains the emotional breakdown, Dr. Gilada?
I think it's a mix of emotions. It's anger, it's fear, it's a extreme sense of being helpless, and all these emotions together at such an extreme was something that we haven't experienced before. When I did this video message, it was actually done for a very close group, like for my families and friends. And I thought that I was receiving so many calls every day requesting for a hospital bed, requesting for oxygen, requesting for medicine, things that we took for granted all these years. And suddenly with this disease, we were left so helpless that all that we could say is, I will try. And yet we knew that we were not going to be able to help them. And in this bargain, we are losing lives. As much as we try to save lives inside the ward, there are many more who we turn down at the hospital. And it's a very unfortunate and sad situation we're all witnessing.
Are you just tired? I mean, I wonder, my son is a young doctor and they do night shifts virtually every day at the moment in COVID hospitals. Are you all just tired? Is there a sense of fatigue, or are you just determined to go ahead, come what may?
I think we're not even thinking of fatigue. I think that's something that's totally out of question. I think none of the frontline workers will say we are tired, because we are just faced with this extremely grave situation, and we understand that we will really have to be strong, determined, and tireless and selfless together to just make through this. So I wouldn't say tired at all, but it's definitely a sense of fear of what is impending, with especially with the rising cases. We do not know which direction we are headed. There seems no respite in terms of improving the healthcare infrastructure or drugs becoming available. And the sad part is, this was all something that could have been avoided. We had this entire 1 year. 2020 was different. We did not have enough information about what the virus was, what were the best precautionary measures. We didn't have a vaccine. We are 1 year later in a worse shape. So it's like, what did we do for this entire year?
What's your message then, both to the citizens whom you addressed in that video calling for COVID appropriate behavior like masking, and indeed to our policymakers when you see, for example, large election rallies going on? As young doctors, do you feel angry?
Yeah, I think, it's just a wrong message sent out to the public. If the people see religious gatherings, political gatherings, how do you think they're going to be serious about this? On one hand, we are talking about mask up, maintain physical distance, and all that goes down the drain in one rally. So I think if we really need to make the community or the entire country serious about it, I think it needs to come from the leadership. And it pains to see that here we are struggling to keep people alive. And on the other hand, it just seems that no one cares sometimes.
Are you proud to be a doctor, that you can save lives at the end of the day at such a young age? You've been, can you hear me?
Now I can.
Many of you have been thrown into the deep end as young doctors. Is this a moment, therefore, for you of a trial by fire for lots of young doctors like you, that you never anticipated when you became a doctor, that this is what you'd have to do? Or do you feel a sense of pride today that you're saving lives?
I think we were not pushed in. I think we did this by choice. Obviously, this was not something we anticipated, but I think we take great pride in being able to offer service to the people when they really need us. So it's definitely, I don't think any of us repent getting into medicine or being where we are. But I really hope with whatever we have, we are able to do the best we can and times just improve now. I mean, we really want this to get over soon. We've all been waiting for, those days that were pre-COVID times.
Very quickly, 30 seconds, what is your final word to the citizens of this country as a young doctor?
We are not asking for too much. All that we are asking for is please mask up. The vaccination drive is going to be open for everyone above 18. There is no need to be hesitant. We've seen the benefits of the vaccine in the second wave. Those who've been vaccinated for 2 doses are not getting to the hospital or are not dying. So we've seen the benefits of the vaccine. And in this extreme scenario where ICU beds are in shortage, I would really request people to only go to the hospital when you really need to. Do not panic and use up beds that are not meant for you. Because every time you're in a bed that was not meant for you, please remember there's someone else dying outside.
How many hours have you got to sleep in the last few weeks? How many hours do you get to sleep?
I don't think none of us are thinking about sleep and food. We honestly do get our breaks because, how will we survive if we don't sleep? But yeah, it has been very hectic. Our sleep is interrupted by calls from the ICU or, frantic calls from relatives or friends. But we hope it's only a matter of another few weeks or months. We really don't want to see this forever.
None of us want to see this forever. I want to, on behalf of all of us at the channel, our viewers, salute you and all the COVID warriors. Thank you very much and stay strong, and thank you above all else. So thank you, Dr. Gilada, for joining me on the show.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.